I'm Scarlett. I'm an art therapist working for Arts for Health. I do group therapies here in Arts for Health, meeting a lot of people and doing art therapy, artwork together. And I also do my private practice as well. So art therapy is a psychotherapeutic approach that we use for the mental health. So it helps clients to explore their emotions and help cognitive responses and build self-awareness and all sort of mental issues. So, well, since I was a teenager, I was interested in psychotherapy areas, especially because I have a brother who's got intellectual disability and he has limitations of verbal communications. So I always try to understand him as much as possible, but I face the limit every time. So I wonder if for someone like that, or someone who can't put their emotions into words nicely, how can I help them? How can they explore? How can they express their emotions and response to their emotions? It's not an easy profession, I think, because we all get like high responsibility of myself and also the client, but it's really rewarding work because we experience that precious moment of acknowledgement or like mindful moment together. So in New Zealand we call it art therapy. So it covers from visual art to meditations, movement, dance, or any type of creative and expressive modalities. But in particular at Arts for Health we do a lot of visual arts, meditations, and bit of movement in art therapy groups. For visual art, there are like dry materials like markers, felts, coloring pencils, charcoals, soft pastels, oil pastels like that. And for the wet materials, we have acrylic paint, watercolor, and if needed, we can extend it to oil painting, but we don't usually do that. And we have a lot of craft materials for like sculpture or 3D type of artwork. So anything can be art materials. For the private therapy, it is totally client-centered. So you come with a matter or questions that you want to find an answer. So we try to work along together and help clients to explore the emotions or responses towards the concern, and we work on it. But for the group therapy, basically, so these are my clients' words. So they come here to meet people, make connections, who shares their personal stories in a respectful way, and also they come for self-care. So me time is really important for them. So coming to the art therapy, not being a role of someone, but they just become themselves and having themselves some time to be themselves. And also they sometimes expect to improve their art skills as well. Well, art therapy is for everyone. Like a lot of people email me and ask whether art therapy is only for people who's got confronting issues or the concerns they want to work on. But in my opinion, especially for the group therapy, it is for everyone. So we do exercise, we go to gym and exercise regularly to maintain our fitness and healthy life. But so we don't do exercise only for rehab. So for art therapy, it is the same thing. So for the group work, you can come here looking after yourself finding a way to express your emotions and notice how you respond to each emotions or stressful situations. So it is a gentle way of building up your muscles in your mind. For art therapy, we don't need any art background. Well, for me, I hate art background. It limits my ability of being free in art therapy. So sometimes it is nice to have no background and just being a beginner of trying something new at all time. And it's it is about anxiety, so I try to gently approach my clients to experience as little as something like drawing lines or repeating colorings, and then we move on to something more deeper. But after 1-2 sessions, I don't see them with a lot of anxiety because no one's judging you. No, as I mentioned earlier, so art therapy, particularly for the group therapy, it is open to everyone. So you can just come without any issues, or sometimes you find your issue through the processes. So yeah, just come and join and meet new people doing something exciting together. So in art therapy, we sometimes work on that particular stressful situations that you face, but so in general, like just little kids playing with the paint, we try to release our stress in a positive ways. Then we find a way to respond to it. So, and then throughout the program, so we, in our therapy, is a safe environment, with clinical therapists. So they're encouraged to release their stresses through different art materials that they feel resonated to, and they work on their responses about the stresses, and they try to find a way to cope with it. So stress does not disappear, but we are practicing to handle it in a positive way and expressive way. So what I think the power of art therapy is, could be like you can choose to be verbal or non-verbal. So it's non-verbal approach and communications of interacting with yourself, inner self, and outer self, and also with clients and the therapist, and also your stressful situations and real responses. So all type of interactions in a non-verbal way. The creative therapy was established in 1940s in the big countries like UK, United States, and Europe. But the type of assessment in art therapy was used earlier in psychotherapeutic or psychiatry field. In New Zealand, if you want to become an art therapist, you have to be qualified as a professional art therapist. In order to get that, you have to obtain the master's degree in Wycliffe College of Arts and Design. The pathway of becoming art therapist is you have to have your own profession at undergraduate. So like I hate art, language, and culture is like that. And then you go to a postgraduate program at Wycliffe College of Art and Design. Once you did your 1 year of postgraduate, then you have to do the masters of 2 years. And then you have to work for a certain amount of hours to be qualified as a full registration. But there are lots of challenges for me, but like when I see my clients, how can I help them to explore their emotions or their inner dynamics in a better way, and then what works for them and what doesn't work for them. So finding out the best beneficial way of art therapy that works for my client is the hardest part. And also sometimes I have my private clients who's got severe concerns that in building up a safe environment and safety for me also is challenging. Then for the group therapy, what can I do more for them and how could they experience different art approaches? That's my biggest challenge. So, or another challenge is art therapy is not so much popular or famous in New Zealand. So they sometimes underestimate what we do, or so people sometimes think we're not professional for psychotherapy area, but yes, we are all studied and we qualified for that. So please try it to find your answers. It's like spiritual and mental processes, so I can't tell exact moment of rewarding moment, but there's a moment of like aha moment. So my clients throughout the art processes, they have a moment of realizing what it was for, what they are looking for, and what they've achieved. So, and witnessing that moment is really rewarding for me. Some of the feedback that I felt really moving was like, in art therapy, I found my way to look after myself and realizing who I am, or so playful that they never want to go home. I love working with children because art therapy helps them to build up their resilience and be self-worth. So that's one of my major clients group. But also I like working with adults because they bring all the values and personal stories into a group and we share, and I learn a lot from them and it inspires me where I go next. For adults group, we living in a busy life and we got lots of roles as we become more and more older. So if you're a lady who's got a family, you are doing your mom's work, wife work, and you have role at work, workspace, and little friends. So you have to be wearing lots of role clothes. But in art therapy, you're taking your roles, so you're taking the clothes of roles and being just yourself, naked yourself. So, and I think in our lives we need time to be ourselves solely. Yes, but it is good. Well, even though you might want to be an art therapist or not, but doing a postgraduate diploma is highly recommended because throughout the process you will know if you're right for the art therapy or not. And it's really, for me, it was another course of art therapy, not to become an art therapist, but more I'm a client exploring myself throughout the course. So I highly recommend to try it out, but to become an art therapist, I think it's still in New Zealand. We are pioneers, so we face the challenges every time in community in a bigger society. But yeah, it's worthwhile. So if you want to receive private sessions, you might be able to find the name of therapist, the registered therapist, in Antakara website. Antakara is our registration organization. So A stands for, so it's like Australia, New Zealand, Singapore, some of Asian countries associations. So you will be able to find all the registered art therapists who can call themselves a clinical therapist. So you contact them personally and make an appointment. Yes. And they'll help you if there's any sort of fundings available. And for the group therapy, you'll be able to search or try Art for Health's website, and we run a lot of art therapy programs every time. So individual therapy, it's only clients in therapy in the room, and group therapy, we have a lot of people having time together, but that's the biggest difference. But for me, the private therapy is more, it's like 100% client-centered. So we find the best way for the client. But the group therapy, we set the goal and expect outcomes, and we program. So we have plans for the whole program at the beginning of the program. So it's not for individual centered, but more like whole group work. With my younger clients, they can't identify or name what sort of struggles they have. So through art, we try to find out what actually matters and how we call it and how we can help. But with adults, because they lived for many years, they have the perceived way of art therapy, or like doing art or learned art techniques that actually limits my clients' explorations, because they try to be perfect, or they try to make a good art piece that could be judged as good. But that's one of the biggest barriers that I experience with my adults clients, because they're living in a cognitive world, and what we expect and experience in art therapy is more like inner world. So Art for Health is a community-based organization offering creative space for anyone who wants to try and experience art. So we have art classes and art therapy classes. So art classes, you can gain more techniques of doing paintings or drawings and any artworks. And in art therapy, you gain more experience of self-exploration and self-expressions in a creative way. So Art for Health is not only for the people who has intellectual disabilities or who's got mental illness. It is open for everyone, because in our community we have a lot of various people, and you're one of the one. So you can just, even though you don't have any issues or any lifetime concerns, you can just come and join us and try something new, meeting new people. It's like another family, but we do our own work. So we respect our spaces, respect what we do. So yeah, I never felt like, I really feel it's like a little family community, helping each other, supporting each other, and trying to find the best way to support the facilitators and also the clients. So at home, if you don't have any like anxiety of doing or making some kind of artwork, you can just start drawing lines or painting a surface, or rip and paste some of papers that you like. But if you need professional support, you might do one of our courses, then it will gradually help you to do some art at your private spaces as well. But also, recently we have a lot of good quality videos available on website, and especially Art for Health's website or YouTube. You can find some of the ways helping you doing art at home. Well, I just want to say, don't be scared of trying something new. You'll find some new hobby or new talent, or like maybe you could feel you're in a community being supported.